A UCL injury of the thumb is a fairly common hand injury in sports and activities like skiing. In this video, I'll describe this injury and how it occurs, as well as explain when the patient needs surgery to treat it. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. So in other videos, I've talked about the UCL injury of the elbow, the ulnar collateral ligament of the elbow that so often leads to Tommy John surgery in professional baseball pitchers and a lot of high-level overhead athletes. But there's also an ulnar collateral ligament of the thumb. It's basically at the base of the thumb. Let's see if I can show you here, close to or on the side of your index finger. If you're looking at a model here, here's your thumb, that ligament is right here. And what that ligament does is it helps basically keep your thumb from being pulled too far away from the rest of the hand. This is an injury that you very often see in sports or activities like skiing. In skiing, a lot of you're gripping the poles and then you crash and basically the pole catches and it pulls your thumb out away from the rest of your hand. Some people call it skier's thumb. There's also a term from way back in the day called gamekeeper's thumb that was related to how they handled chickens, roosters, things like that, and you could get that same injury. Nowadays, other than skiing where you typically see it, is a sport like baseball where the base runner will slide into, say, second base and the thumb will catch on the base as they're going by, pulling it further away. Sometimes it can be a sport like basketball or football. Maybe you get your thumb caught in the jersey of another player, but something that pulls the thumb away from the rest of the hand, injuring that ulnar collateral ligament. Now, occasionally that can heal without surgery. If it's basically a minor injury, that tendon is in place and there's not a lot of opening of the joint, sometimes that can heal without surgery. That would be some sort of thumb spica cast or splint that basically holds the thumb in place, doesn't allow any motion while it gets it to heal. On the other hand, though, some of those injuries have to have surgery. There can be what's called a Stenner lesion where basically the ligament tears and it flips out outside of what's called the adductor tendon. And then there's no way for that tendon to heal back down to bone properly. And so the surgeon has to go in there and put the ligament back in place and reattach it with stitches and anchors. That surgery does very well. It's a short outpatient surgery, but it's a fairly long recovery, basically immobilizing that thumb while the ligament repair heals and then working to get motion and strength back and things like that. So that's where it's important. As far as regenerative treatments, it's possible that something like stem cells or PRP or exosomes might help that ligament heal in a non-surgical treatment. But again, that assumes that there's not instability of that joint, which you wouldn't really know unless a hand surgeon did an exam. And you would want to make sure there's not that Stenner's lesion, because then it doesn't matter what regenerative treatments would be, probably not going to help that heal. As far as some like a peptide like BPC, maybe that could help the ligament heal quicker. It's hard to know necessarily. That really hasn't been studied in humans. Potentially could help. As with any of the regenerative treatments, whether it's peptides or stem cells or exosomes, all of that is considered experimental by the FDA. I'm not promoting it. That's something that you can talk to your doctor about. And I've got lots of videos on regenerative treatments on this channel where I talk more about why they're experimental and what to know about it, all of that kind of stuff. But people ask me about, would regenerative treatments like BPC 157 or exosomes or stem cells help for this or this injury? This is one, in theory, there could be a role either to help speed the recovery during surgery or to help a fairly minor injury heal more completely and more quickly. But again, there's a lot to think about when you're talking about those kinds of treatments. All right, I'd love to hear about your experience with your hand injury. If you've had an ulnar collateral ligament injury of the thumb, leave those in the comments below. Just understand, if you do leave a question in the comments where you're asking for medical advice, I can't give you medical advice. But what I do is I address that topic in a future video. Make sure to subscribe to my channel and click the bell to be notified when I release a new video and when I start a new live stream, including my Ask Dr. Geier live shows. Thank you so much for watching. I look forward to helping you feel, look, and perform better than ever.